What is post-void residual volume, PVR test? Have you ever wondered how doctors assess bladder health? One important tool they use is the post-void residual volume test. This test measures the amount of urine left in the bladder right after someone has urinated. It helps to evaluate how well the bladder empties during urination, which is crucial for understanding bladder function. The PVR test is particularly useful for detecting urinary retention. This condition occurs when a significant amount of urine remains in the bladder after someone has tried to empty it. Urinary retention can be a sign of various underlying issues, such as problems with bladder muscles, blockages in the urinary tract, neurological disorders that affect bladder control, or even side effects from certain medications. It can also relate to complications from bladder cancer or its treatments. There are two common ways to perform the PVR test. The first method is catheterization. In this approach, a sterile catheter is inserted through the urethra into the bladder. This allows for direct measurement of the residual urine volume. While this method is accurate, it is also invasive. The second method is a non-invasive ultrasound bladder scan. In this case, a device is placed on the lower abdomen to estimate how much urine is left in the bladder using sound waves. This method is painless and is often used for screening and follow-up assessments. Normal PVR volumes are typically low, often less than 50 milliliters. If the volume is higher, it may indicate that the bladder is not emptying completely. This could lead to further investigations and management options. In the context of bladder health and bladder cancer, measuring PVR is especially valuable. It helps identify bladder dysfunction that may be caused by cancer itself or by treatments like surgery or radiation, which can impact how well the bladder empties. Additionally, monitoring PVR can help detect complications such as urinary retention, which can increase the risk of urinary tract infections and affect a person's quality of life. The PVR test provides important information about bladder function, guiding healthcare professionals in making effective management decisions for bladder-related conditions, including those associated with bladder cancer. It is essential that the results of the PVR test are interpreted by healthcare professionals within the broader clinical context to ensure accurate diagnosis and appropriate treatment. Always consult with a healthcare provider for personalized medical advice regarding bladder health.